Hey, everybody, and welcome to the newest podcast, running out of Metro Detroit, directly through the leadership of Detroit Cancer Screening Initiative. It is a lung cancer initiative that has the number one goal of helping people here in Metro Detroit that struggle with cancer, that are struggling with cancer, specifically lung cancer here in Metro Detroit. That is the number one cause of cancer in the United States. And so what we've done is we've created an initiative to help those who are struggling in that area. And very first person that we're bringing on today, very excited to have him. This is Dr. Lawrence MacDonald. Very excited to have you and be talking through the lung cancer initiative. So Dr. MacDonald, just to kick us off a little bit, tell us a little bit about who you are, what you do here in Metro Detroit.
Sure. Well, I've been around a while. Nice to see everybody. This is fun. I'm a pulmonologist. I'm a lung doctor and an intensive care doctor. And I work throughout Metro Detroit, mostly out in Oakland County at Huron Valley Sinai Hospital, Providence Hospital in Novi. We have an office in Novi. Also work at Sinai Grace in Detroit, Sinai Grace Hospital in the DMC. But I've been around. I went to Wayne State for undergrad and for medical school, and then trained at Henry Ford Health Systems for 3 years in pulmonary and critical care. And I've been around the Detroit area for a few decades now, helping to take care of people, mostly now with lung disease and critical illness.
Awesome. So like I said, very excited, very happy to have you on the podcast and being a part of our very first one. This is great for what it is that's happening. But very first thing that I wanted to jump into with you, Dr. MacDonald, the Detroit Cancer Screening Initiative. Why does this exist? Why is this something that's been on your heart and the heart of so many doctors here in Metro Detroit? Why do this?
Yeah, sure. It's not just me, there are several physicians, surgeons, oncologists, radiation oncologists that specialize in giving radiation, nurses, hospital administrators, people from the pharmaceutical industry. They keep showing up to meetings. They really inspire me. We've been around for about a year, and our goal is to help decrease death. We don't want people to die. People die of lung cancer a lot. If you have the number one cancer killer, which is lung cancer in both men and women, and you have a large population like we do in Metro Detroit, it really is worth trying to screen for it. A screening test is something that you take a group of people who feel okay and you look for a disease. And the disease you look for, some disease that can hurt you, that you can find it. And if you find it, you can treat it and make it better. And it turns out lung cancer is really one of those diseases. If you go to a party and you ask a question, what's the number one killer of women by cancer? And a lot of people say breast cancer. Well, that's important. It is. Breast cancer is very important. You should continue to work on it and screen for it. But far and away, lung cancer. Lung cancer kills more cancers than the next three combined. So the reason we want to do it, lung cancer is important. It's the number one killer. Second, there's a screening test for it. You can look for it before you feel sick. You can find it before you feel sick. You can find it at a stage where if you find it when it's small, you can cure it instead of waiting like we often have done over the years, waiting until it's too big to treat and people don't do as well. So that's why. And we specifically, we're working in Detroit because it turns out Detroit's got all kinds of resources, all kinds of CAT scanners, all kinds of places to go to have the test done. But we could do more. We could screen more people. In the United States, probably 10% of the people or so who need this test get it. So most people who need it don't get it. So our job, we get together every month or so and we work behind the scenes, and we're trying to create a program where people just know about this and show up to the places that already exist where they can have a scan.
That makes a lot of sense. This is all new to me too. So for those of you who are listening or paying attention to this, I'm not a doctor. That is not what I do. I'm just as a means of interviewing and having a conversation with some of the physicians that are here in Metro Detroit. And so one of the things that's really drawn me, Dr. MacDonald, to being a part of this initiative as just a local business owner is really fighting the statistics that are already out there of how many people are actually passing away from lung cancer. It's the numbers are astronomical. It's absolutely crazy. And it's crazy to think that if 10 people are scanned, you're going to find one who right now needs help. And the extension of their life is a possibility because we're catching it now. I think that's a huge piece that I've heard in a lot of our meetings and stuff like that too.
Yeah, we find a lot of stuff. The numbers actually are a little bit better than that. If you're, like if you take 100 people who smoke a fair amount, and those are the people who in general meet the criteria to start looking for lung cancer. If you smoked a pack a day for 20 years, and you're over 50, you meet the criteria to get screened. Even if you quit within the last 15 years, if you're 55 and you quit when you're 41, you still meet the criteria because it's within the last 15 years. If you look at people like that, if you take 100 people like that and you do a CAT scan on them looking for cancer, 100 people, about 20 of those people are going to have a spot in their lung. Most of the spots are not cancer. We find other things too. We find emphysema. We find hardening of the arteries in the heart. We find other stuff that matters. We find a lot of, just by accident, we find other diseases that are worth looking for, because if you find them, if you treat them, and you can prevent death or, prevent illness. But yeah, about 1 out of 5 people are going to have a spot. Most of them are not cancer. That's why you don't just go get a scan. You have to work with your doctor. You got to show up to your doctor and say, what does this mean? Like, I got a spot in my lung. What does it mean? What it usually means is nothing. But that's an important question. So that's what we do a lot of our day. Got a couple nurse practitioners, Andrew Campbell and Kara Bailey, who work with us. We look at CAT scans all day. I work with other surgeons and radiologists, and we look at spots in the lungs all the time, trying to figure out, what does it mean? What do we do? Most of the time, we just watch them, but sometimes we do other things too. So, yeah, we're going to find a lot of stuff, and it's worth finding, Rory, for sure.
That makes a lot of sense. It's reassuring to me that you guys are able to find other things and be able to treat that stuff too. Knowing that cancer is not the only thing you're looking for. You're taking more of a holistic approach of taking care of people, really in their lungs, more importantly. So I don't know if anybody listening is anything like me, but I am not a fan of going to the doctor. I'm not a fan of CT scans. I'm not a fan of x-rays. Go down the list. I'm just not a fan of those things. And I was just curious to know, as somebody who, let's say I qualify for this, what does it look like once I sit down with my primary care physician? What's my next step? If I qualify for this and I'm going and I qualify for this CT scan, what does that consist of? Do I have to get a shot? Do I have to get an IV? Do I have to, how long am I going to be sitting in line, waiting in the lobby? Things like that. What does this consist of, just so I know?
Yeah, for sure.
In prior to.
Yeah, it's not like going to the Secretary of State's office. You're going to be in and out pretty quick at most places, you get a CAT scan quicker and you're going to get a new license plate. How about that? It has to be, you brought up a good point, Rory. You said primary care doctor. Yeah, you can't just walk in and get a CAT scan. It's not like popping in for a cheeseburger at McDonald's. It's a medical test, so you have to go through your doctor. If you don't have a doctor, you really need one. Having a primary care doctor is really, really important. I can tell you, I'm not a primary care doctor. I'm the specialist. I can't do all the stuff they do. I don't take care of people's cholesterol, pap smears. My shoulder hurts. I can't see out of my right eye. I'm dizzy. I don't do any of that stuff. You need somebody who does. You need a doctor who does all that stuff. Primary care doctor. Well, one of the things your primary care doctor can do, they can order all these screening tests, and they know which ones to order. So your doctor should know this. Your doctor will know how to order this. If they don't, or if they haven't done it yet and you think you need one, on our website, there's a piece of paper you can take to them and say, here, please do this, or think about doing it anyway. But I forget, what was the question?
What does this consist of? What does it look like?
Yeah. I'm not a woman, but women who go for a mammogram will tell you it's not the most pleasant experience. You should get them. If you're a woman and you meet criteria for a mammogram, please get it. You can save your life that way too. If you are the right age, I've had 3 colonoscopies. I get it. If I find lung cancer or colon cancer early and I treat it, I'll do better. I'm less likely to die. So those are worthwhile tests. if you've ever had a colonoscopy, you got to drink all kinds of stuff. You got to clear out your colon. You can't eat what you want for a couple of days beforehand. If you have a mammogram, it's a little discomfort. Those are good tests. You should do those. You should do them through your primary care doctor. But lung cancer screening is even easier. Basically, once you go to your primary care doc, you get a prescription. Here, take this. On our website, you can see all the sites that we could find in Michigan. By the way, we're not affiliated with any particular organization. We're with all of them. We just want you to go to something that exists in one of the really good health centers that we have in Detroit area. Anyway, you show up, you go through all the usual insurance stuff. And once that's done with your prescription, you lay on a table, you take a deep breath, you hold it. Even people with bad lung disease can hold their breath long enough to have a scan. Some places even let you leave your shirt on. At most you'll have to change your shirt into a gown. You don't need an IV. You don't get any dye. You don't need dye. We do it without dye. And the non-contrast is what we call it, a non-contrast CAT scan. And it takes minutes, literally, you're in and out. And what happens then is you should do it at a place that's accredited. What does that mean? That means that somebody's looked at this place and said, these guys do a good job. They follow all the rules. They have good protocols. They do quality work. They check their quality with quality assurance protocols all the time. They have qualified board certified radiologists. They have people who communicate, send out reports to primary care physicians and people like me, a pulmonary physician. They do all the right things. You should go to a place like that, and we list them on our website. You go there, and then your doc will get a report in a couple of days. Some places will give you a report. Getting reports can be kind of scary. That's why you really need to go back to your doc. You need to go back to your primary care physician and go over it. Don't get freaked out by reports. Don't get freaked out because it says there's a nodule or 2 nodules or whatever. Medicalese, medical jargon, it can be scary. That's why you really got to do it through your doctor. You go back to your doctor and say, hey, what does this mean? Let's go over it. If you don't mind, spend 5 minutes with me going over my CAT scan report. What does it mean? And then most of the time you'll be very reassured. You'll say, hey, gosh, this is great. I don't have lung cancer. I got a little nodule. It's probably nothing. I'm going to get one next year anyway because I'm going to get one every year and we'll watch it over time. And I got nothing else wrong with me. Or, maybe you'll come back and say, hey, geez, I got some hardening of the arteries, atherosclerosis in my heart arteries. Maybe I should have a stress test. Maybe I should lose weight, quit smoking, cut my cholesterol, check my blood pressure. Geez, it showed I got emphysema. I've been trying to quit smoking. Maybe that'll be a little bit of more of an impetus for you to do that. So it's a pretty easy test to get. Really important to do it through your doctor. You can't just show up and get it. Once you get it, it finds information, and it's not a hard test to do. It's really, you got to go and park and you go walk in the hospital and stuff like that. That's going to take more time than the test does.
No, that helps me a lot. Helps me understand really the process. I mean, you laid it out very well for that. Dr. MacDonald, when it comes to now speaking to some of the other physicians and some of the other medical personnel that maybe tuning into this too, and they're hearing some of the things that you're sharing, and they're going, "Hey, how do I get involved? How do I become a part of the Detroit Cancer Screening Initiative? How do I partake in this? Where would you send them?"
A physician? Well, most primary care physicians or specialists know about this. It's all over. It's not so much doctors not knowing about it, but if they want to join us, just look it up. Our website's there on the screen, passing under your eyes as we speak. Glad to see it's got you'll find our phone number there. You'll find our email addresses there, our board members. Bunch of good guys, bunch of good, nice ladies and men who come together. We'd love to have more participation from other physicians because nothing bad comes of it when a bunch of good people get together in the same room.
No, absolutely. I can agree with that. So anybody who's tuning in today and you're listening to this podcast, maybe this is the first time that you're hearing about this taking place, definitely bring this up to your primary care physician, as well as go and check out the website. Go and look at the DetroitCancerScreen.com website. Look at what exists on there. Look at some of the locations where you can have a screening done as well. And specifically, anybody who out there, is there anybody listening who maybe was a smoker or is a smoker? What would you say to them? Just as kind of a call to action and saying, hey, here's your next step. What would you say to that,
Yeah.
Doctor?
let me just talk about smoking for a second. I think you're going to have other people, Dr. Sternberg, Dr. Faust, perhaps talk about smoking cessation, and I'm going to tune into those because they'll have a lot to teach me. Again, a couple of good guys who are working on this with us, but the smoking cessation is more important than this CAT scan. You know, if you're going to get a CAT scan but keep smoking, that's okay. I'm glad you're getting the CAT scan. Quit smoking too. It's not your fault you can't stop smoking. It's not your fault. Forgive yourself. Move on. Don't blame yourself. Nicotine is extremely addictive. When you take a hit on a cigarette, it goes into the lungs, and then because the lungs are bathed in blood, it comes back to the heart that pumps it right to the brain immediately. There's no other drugs that's more addicting than nicotine, because you take one hit on a cigarette, goes to your brain, gives you the pleasure, the hit, you feel it. So that's extremely addicting. If you are having a hard time quitting, it's not your fault. You're not a bad person. You're not weak. You're not anything bad. It's a tough thing. Talk to your doc. There are some ways to quit. Frankly, the most common way to get people to quit is to have a physician tell you to quit smoking. So quit smoking. But it's hard. It costs a lot of money too. I talk to people who smoke a pack a day. I mean, you're talking about a decent car payment. I don't have to tell you that. I'm sure you've gone through that thinking. But what I would do first is quit smoking. That has many health effects: lung cancer, coronary disease, stroke, other kinds of cancers like bladder, other diseases that are worse with smoking. So
I think it's a very good next step for anybody out there. But if you are tuning into this podcast and you want more information, definitely check out DetroitCancerScreen.com, the website, scrolling across the screen like Dr. MacDonald pointed out, and get more information. Tune into what it is that's happening in the area, and potential next steps for you are already listed on there for what you can do next. So, Dr. MacDonald, very thankful for what it is you and the physicians that are a part of the DCSI here in Detroit are doing, and very thankful for you to being able to make time to be on the podcast today. I know you're a busy guy, and being able to be here is an absolute blessing, not only to me, but to those who are able to tune in today.
Well, we're having a lot of fun working together, and love to entertain the participation of more people if they want to check out our website. So thanks.
I love it.
Right.
Thank you guys so much. And hopefully we'll catch you next time on the DCSI podcast. Have a good night.